Hi everyone, I'm Dr. Connie, and today I want to talk to you about a topic that is near and dear to my heart. It's lupus. It's been about 19 years since being diagnosed with this terrible disease, but I feel we've come a long way in understanding this disease that affects over 5 million people worldwide. Lupus is an autoimmune condition. This means the body gets confused and begins to destroy its own cells by producing antibodies. And although the cause is unknown, we understand the workings of our immune system to triangulate the explanation that autoimmunity occurs when your body is trying to defend itself against potential toxins or pathogens. It's important to note that our world today abounds with toxins, and toxins are not isolated to things we eat or inhale. But stress indirectly can have a toxic effect by compromising our immunity against such pathogens. Think of it this way. Our bodies have a robust army whose role it is to defend our cells and organs 24/7. And because of increasing toxins in our modern world, from additives, preservatives in our foods, to pesticide residue on our produce, and GMO products, which is genetically modified foods, and hormones and antibiotics in our meats, our immune system not only weakens, but our genetic code is altered as well, weakening our gut lining and all systems in our body. So the offensive harm to our body is increasing, while our defense, protecting our bodies, is decreasing. Lupus is unique in that it can affect more than one system simultaneously. And the underlying root cause of all other autoimmune disease is acute or chronic systemic inflammation that leads to self-destructive cells. So some of the signs and symptoms. The signs of lupus range from mild to severe and can be life-threatening. Lupus mimics other diseases because it can involve multiple systems, and the symptoms can fluctuate or change their course altogether. And the most common symptoms are headaches, fatigue, fever, joint pain and swelling, butterfly-shaped rash across the nose and the cheeks, severe hair loss, anemia, and ulcers in the nose and the mouth, and edema, water retention in the hands and the feet and the face, sensitivity to sunlight, and digestive problems like irritable bowel syndrome. So how is it diagnosed? Well, lupus is not easily diagnosed because of its tendency to mimic so many other diseases. It's not unlikely that you'll see a number of specialists ranging from cardiology, dermatology, infectious disease, to finally rheumatology. And in some cases, it takes time to fully diagnose because in certain patients, they may have symptoms long before the antibodies, which are inflammatory markers, showing up in the labs. It took me personally 8 months to get diagnosed, and it was a frustrating process as I was really sick and no doctor was able to come up with a diagnosis. In fact, they looked just as confused as I was. So how is it treated? Well, lupus is mostly treated by managing symptoms rather than addressing the underlying issue. Typically, medications are the primary way symptoms are controlled, and such medications can cause secondary complications with side effects. Corticosteroids are commonly prescribed to downregulate our immune system, putting patients at further risk for infection. A host of immune-suppressing drugs are also used in conjunction, which also can cause cancer. The treatments are limited, and I was confused and frustrated at the lack of direction I was given in dealing with my condition. I was told there was no cure and that I should refrain from having any kids, pace myself by taking it easy and resting when I needed, and to avoid stress. That all seems so general. And in my efforts to minimize the toxic meds, I've made my health a priority. Health takes work, but can be created, I learned. I personally took matters into my own hands, and my 19 years of living with lupus has been an experiment without a clear prognosis. I just wanted to be healthy. So from Eastern Chinese medicine to Western medicine, I'm not sure we really understand the disease. But Eastern medicine made more sense to me because it was all about getting my body back in balance by supporting me and my cells. Versus Western medicine helped me manage my symptoms when they were out of control. But managing my symptoms was not a real good way and a strategy or a long-term strategy for me. So I've struggled with nephritis, which is kidney inflammation, 3 times, and severe bout of irritable bowel syndrome, and debilitating pain and fatigue were a common occurrence for me. More recently, I'm participating in a clinical trial for the first ever lupus-specific drug, and I felt hopeful that it will keep me in remission. And this month is Lupus Awareness Month, so I wanted to take the time to share what lupus is so that you can be more empathetic towards this potentially debilitating disease. Raising awareness will help many people understand that you can still create a healthy life against all odds, because I did. And if you or anyone you know that suffers from lupus, please share this message and subscribe to my channel. I invite you to join our alkaline movement in creating our health. So with that, I'll see you next time.